Gwendolijn Boonekamp, or Gwen in short, and I'm from the Netherlands. I work in higher education with mainly students focusing on sport and exercise. And I also, I'm doing a PhD that is focusing on how to enhance physical activity in adolescents in school setting. Community health, the way that I'm involved in it is mainly related to working with my students and to thinking about how to work with schools, viewing them as a community. So my community is mainly focused within the educational sector. It's very compartmentalized, so there are many different organizations trying to contribute to community health, which often makes it quite complicated for people who need some support to find the right person or the right kind of assistance that they need. It's still very problem focused and not very much asset focused. I think there are several roles or titles that can be distinguished because many of them look from their own background to how they can contribute to community health. For example, from my point of view or from the sector where I'm related to, there are sports community workers that also have a link to youth workers and health workers, but they try to intervene from a sports and physical activity perspective. And they meet all these other community workers and try to reinforce each other's competencies in the field. But I suppose that everyone has their own specific focus on what they would like to contribute to community health. What I've learned is that it's so much, it can be so much stronger or much more effective if an asset approach, a much more grassroots approach, starting from the objectives of a community itself, would be taken instead of trying to intervene from the outside, from a professional point of view of where the needs are or the focus should be. And I think there should be a better balance between what professionals think that need to be done and what communities actually want themselves or see themselves as the priorities should be tackled. So in higher education, there is a lot more information on the health status or the mental health status of the students, and there is big problems. Time that is generating a lot of care infrastructure in the educational sector or in the universities. And what we are actually trying to do is to turn it around, and we set up what we call a coach office, in which we train students to help other students to focus on assets and have more agency over the whole study process, the things they need to do to balance studies and personal life and priorities. To avoid that they need help in the long run. And of course, that needs to be some help in place if problems arise. But we try to focus on the health promotion side and not on the risk side. Well, the barriers is this very well-established thinking in risks and in trying to prevent problems, and in the cultural way of thinking that professionals know better than, in our case, the students themselves. And the lack of time and openness to really discuss with each other this whole different approach of trying to strengthen people, their strength, instead of trying to solve all the weaknesses or problems that may arise. Facilitators is that more and more people are becoming aware of the need that if we don't do anything about this, we are not delivering students, delivering maybe is not the word, but that we are not educating the students to become independent, healthy, vital, self-aware people that we want them to be. So as long as they feel that they need help with a lot of things, or that they have the idea that they are not in charge of their own learning process, you create some kind of vulnerability. They feel more vulnerable when things like, for example, now the COVID crisis comes along, and they don't really see how they can make arrangements to tackle that situation and to face all the stress that comes along with it. We are trying, we have a minor course in which is a course within the bachelor degree that is optional. It's an elective, so students can, from all kinds of different bachelor degrees, can choose for this. It's an international global health minor, and we split the semester in two. And the first part, we give them all this kind of ideas and tools and knowledge about how to work with people, how to think in strengths and not in weaknesses, how to look for opportunities and develop opportunities, how they can develop their own skills and use their own skills and experience to help others. And especially learning them to go out and listen and observe and see what other people are doing, and not try to impose their ideas or their impression or their diagnosis on what's going on. And with these tools and knowledge in their head and hands and hearts, they go in the second part of the semester to a country abroad. We've got several projects in different parts of the world, and varying from Latin America to the Caribbean parts of the Netherlands, to European countries, to Asian countries. And they go out there and work with the community on one of the priorities of that community to improve their community health. And that can be anything. And it's especially important that they don't impose their ideas on them, but they develop an idea that that community wants to work on. It impacts my personal work a lot, because higher education institutions were closed. So all the students had to stay at home. We had to work from home. I particularly work with graduating students. So they were all doing their traineeships. Many of those traineeships could not be carried out because the institutions or the workplaces where they worked were also closed down. So besides teaching online and trying to convert all my material into material that could be transferred, transmitted online, it also meant that we had to improvise a lot, change assignments for students, so would not like fall behind too much because of the limitations of the COVID-19 pandemic and them not being able to work in the organizations that they were supposed to work in. So students were suffering a lot, many of them. So we had a whole line of coaching as well in place that we had to think of like on the spot, because we had no experience with that before either. Other students fared quite well because they thought it was interesting and useful to be very focused on what they were doing, and they had no other activities that would distract them from their focus on their work. So for some, it was really good. In my personal case, at some point, it was also good because I could focus on my students and on my PhD, with not too many side tracks being asking for my attention. It has changed. It has changed education, I think, permanently. We will probably go back to some point to teaching live again, which I will really enjoy, because I prefer to see my students face to face. But I think online teaching will stay a part of what we're doing as well. My advice would be interested in stories. Just don't only focus on what people are doing, on their behavior, but be aware and be interested in the context people live in, work in, are being born in, and the impact that has on what people do and what they may or may not be able to envisage as possibilities. Because if you're stuck in a situation or in a context, it's sometimes really hard to see beyond the boundaries that imposes on you. And I think community health workers should focus on trying to see people in these contexts and then try to help them to recognize possibilities, recognize resources, trying to translate them into assets by working with, for example, theories such as salutogenesis and the dimensions of meaningfulness and comprehensibility and manageability. And I think it would be really important to focus on agency, which in my opinion has a lot to do with autonomy. So people have autonomy to set their own goals, and with some kind of freedom to pursue these life goals, and not focus merely on health as an end itself, health as a means to be able to pursue life goals that people can define themselves.